In a world already grappling with the aftershocks of a global pandemic, a far more insidious and deeply rooted threat is tightening its grip, and this time, it is targeting children with terrifying precision. More than 3 million children died in 2022 from infections that no longer respond to antibiotics, according to a new study led by two global health experts. This figure, beyond being a statistical alarm, is a profound indictment of our collective failure to contain one of the most dangerous and least visible crises of our time, antimicrobial resistance, or AMR. The numbers are staggering, but the real horror lies in the fact that most of these deaths could have been prevented, if only the world had acted sooner and more decisively. The silent killer behind these deaths is not a new virus, a natural disaster, or an act of war. It is the result of decades of human negligence, short-term thinking, and systemic underinvestment in health infrastructure and drug development. Antimicrobial resistance occurs when the bacteria that cause infections mutate or evolve in such a way that the drugs designed to kill them lose their effectiveness. This isn't science fiction, it's biology, accelerating faster than our medicine can adapt. And children, especially in Africa and Southeast Asia, are paying the price with their lives. This is not a marginal issue. AMR has already been recognized by the World Health Organization as one of the greatest threats to global health, food security, and development today. But this latest study shows that the threat is no longer looming. It has arrived, and it is devastating. That more than 3 million children lost their lives in just 1 year because of infections we should, in theory, be able to treat is not just a medical failure. It is a humanitarian catastrophe. What's even more alarming is how quickly the problem is worsening. According to the study, there has been more than a tenfold increase in AMR-related deaths among children in just 3 years. This explosion is partly attributed to the widespread misuse of antibiotics during the COVID-19 pandemic. As healthcare systems buckled under pressure, antibiotics were handed out indiscriminately, even when they had no effect on the viral infections patients were dealing with. Antibiotics do not work on viruses like COVID-19, the flu, or the common cold. And yet, in the rush to treat symptoms or prevent complications, these drugs were dispensed liberally, often in situations where they were completely unnecessary. The result is a grim scenario in which bacteria are evolving resistance faster than we can produce new drugs. The pipeline for developing new antibiotics has all but dried up. It is a slow, expensive, and low-profit endeavor for pharmaceutical companies. Meanwhile, the bacteria continue to outwit us. The misuse of antibiotics in healthcare settings, in agriculture, and even through contamination in our food and water supply has accelerated resistance on every front. We have now entered an era where the antibiotics we once reserved as last resort treatments, the so-called watch and reserve antibiotics, are being used routinely, especially in regions where health systems are underfunded and poorly regulated. In Southeast Asia, the use of watch antibiotics jumped by an astonishing 160% between 2019 and 2021. In Africa, the figure rose by 126%. Even more disturbing is the rise in the use of reserve antibiotics, the final line of defense, by 125% in Africa and 45% in Southeast Asia. These are drugs meant to be preserved for the most severe and drug-resistant cases, and their overuse is nothing short of a death sentence for future patients. Once bacteria become resistant to these, there are virtually no alternatives left. We are perilously close to a reality where routine surgeries, minor infections, or even childbirth could become life-threatening events simply because the antibiotics we've always relied on will no longer work. The consequences for child health are especially dire. Children have weaker immune systems and are more vulnerable to infections. Many of the illnesses that once could be managed with a short course of antibiotics, pneumonia, sepsis, urinary tract infections, are now becoming more difficult to treat, more expensive to manage, and more likely to result in death. In countries already struggling with limited healthcare access, the impact is catastrophic. The death toll is not just a statistic. It represents futures erased, families shattered, and communities plunged into deeper cycles of poverty and grief. Experts emphasize that there is no single solution to the AMR crisis, and that itself is part of the problem. This is a crisis that cuts across every sector: healthcare, agriculture, sanitation, public education, and pharmaceutical innovation. Antibiotics are everywhere, used in food production, poured into our environment, handed out in clinics without prescriptions. The overuse and misuse are systemic and global. This means the solution must be equally far-reaching, but right now, the global response is patchy at best and negligent at worst. Preventing drug-resistant infections starts with preventing infections, period. That means improved access to vaccines, better sanitation, clean water, and rigorous infection control in hospitals and clinics. But these are long-term infrastructure investments that require sustained political will, something that has been sorely lacking in many parts of the world. The countries hardest hit by AMR are often those least equipped to tackle it. This is a crisis compounded by inequality, a global health emergency that deepens the divide between rich and poor, between those who can afford advanced treatments and those who die for lack of basic medicine. If world leaders continue to delay, to underfund, or to ignore the growing mountain of evidence, AMR will not just undermine decades of progress in child health, it will unravel entire public health systems. Already, the shadows of a post-antibiotic era are creeping in, where medical procedures we take for granted today may be impossible tomorrow. Organ transplants, chemotherapy, even dental surgeries depend on effective antibiotics to prevent infections. Without them, modern medicine collapses. This report is a dire warning, and yet, tragically, one that may still go unheard. The clock is ticking, and the bacteria are winning. Unless the world wakes up to the true scale and urgency of the antimicrobial resistance crisis, millions more children will die needlessly. What we are witnessing is not just a failure of medicine. It is a failure of imagination, of preparation, and of responsibility. And the cost is being paid in children's lives.